In Dallas, on the city's east side, Lakewood residents live an average of 83 years. But just 5 miles south in the Fair Park area, life expectancy is only 65. Called social determinants of health, factors like zip code, income, and race can influence how you live and when you die. I'm Nancy Brown, Chief Executive Officer of the American Heart Association, and it's such an honor to be here today with Raymond Guthrie, who is recently joined our team to lead our new Social Impact Fund. Welcome, Raymond, to the Heart Association and to the exciting work that you're leading in social impact. Tell us a little bit about the work that you're doing.
Thank you, Nancy. I really appreciate the opportunity to be here. The fund is trying to address what you just described, inequalities, health inequalities, by trying to shift the health paradigm, by investing in local entrepreneurs and empowering them with the resources and the support to actually take on social determinants of health in their own local communities.
You know, I think it's really important because oftentimes large national organizations like the American Heart Association are able to bring amazing resources and, of course, for us at the HA, a science and an evidence base to what we do. And a lot of times the best solutions come from the community themselves. Tell us a little bit about what you're finding in some of your early work.
Yes, and the fund is actually built so that it's nimble and reactive to the local environment. So really meeting entrepreneurs in the communities where they are, employing a bottom-up approach for how we're going to invest. So not coming in looking for problems, but coming in looking for solutions and what's worked, and figuring out what's necessary and what's needed to help raise those solutions to a level where they're actually making a dent on problems. At the same time, we're also looking at what are people doing within those local communities and figuring out where there are gaps and where the AHA can provide resources to help fill those gaps. So what we found is that having a nimble approach that isn't focusing on one special health problem or one special type of instrument to invest with enables us to really be that complementary investor to a lot of the great organizations in those areas already.
I'm very excited that as we've launched the fund, thanks to the generosity of David and Stevie Spina, we've been very focused on two really critical markets where we see amazing health disparities, Flint, Michigan, and Boston, Massachusetts. Tell us a little bit about what's been going on as we've launched our work in those areas.
Yes, and I should say it's quite personal for me. So like you, I grew up in Michigan, and I was born to a hardworking family, and I grew up in Bloomfield Hills, where the child poverty rate is actually 7%, but in Flint it's 60%. And so having the opportunity to invest in the area to help overcome those challenges, as opposed to sitting back and saying that's a shame, but instead being a part of a catalyst for change, is what the AHA is doing, and I'm really proud to be a part of it. So we're seeing a really great response from people in Flint for one, seeing the AHA come in and take an approach like this that's very adaptive and inclusive. But we're also seeing a really great groundswell of people actually already applying to the fund.
That's fantastic. And I know our vision ultimately is to scale the Social Impact Fund to impact communities throughout the country. And it really will allow us to build on the foundation of the HA, our brand, our science, and our grassroots in solving these inequities. Raymond, we're so honored to have you at the helm, bringing all of your experience and expertise as an investor and someone who also is deeply studied in how to make impact in communities. So Raymond, with all of this great information and the momentum that we're building, how can our donors and volunteers get involved? How can they help?
Well, if people are excited about this idea and want to bring the Social Impact Fund to their area, we're always still looking for other donors so that we can expand to new regions. To our great volunteers, any expertise that they can lend to help us evaluate new opportunities, as well as drive great entrepreneurs to the fund and spread the word about what the fund's doing and the impact we're creating in the local communities would be great.
Fantastic. And they can reach you how?
At the Social Impact Fund at heart.org.
Okay, Social Impact Fund at heart.org. There is the call to action. Thank you all for listening in today.